Well, good evening, everybody. I'm Ward Blackwell, Executive Director of the Pennsylvania Dental Association, your host for tonight's Bridging the Info Gap webinar. This is an opportunity for our PDA membership to hear from their leaders on a variety of issues, and we're very glad you're joining us. Few preliminary housekeeping things we got to go through before we get into the meat of this program. If you are an attendee as opposed to a panelist, you are in listen only mode. You will not be able to open your mic and say anything. You won't be able to turn on your camera, etc. However, you can ask questions of our panel tonight by typing them into the question box. That is located typically at the top of your screen. There's a couple different symbols up there, but you look for the one with a little question mark in it. That's the place you type in your questions. During the last 10 or 15 minutes of the webinar, we'll read them aloud and direct them to the appropriate panelist. Just one little extra note. Some of you may have given us some topics for discussion back when you registered. We do appreciate that. Just a note about how that's going to work. Some of those topics are a little too complex to address without more time to prepare, but we will try to address them in a future webinar. Dental insurance reimbursements would be one such topic. Other topics we will pose as a question to one or more members of the panel at the end. And finally, there are at least a couple of things that aren't really PDA issues. And on those, we will try to connect the members who submitted them to an appropriate knowledgeable source to get an answer. Okay, with those preliminaries out of the way, let me get to the advertisement now, because our webinars are always sponsored by PERC, our subsidiary, and the PDA Member Advantage program, which seeks out and vets exclusive values for our members. Really great deals can be had. One such example, our endorsed insurance agency, Alera. It used to be known as PDAs, but now they go by the brand name Alera, and they still offer the same great service and work very well with dental offices to find you the very best coverage. Another excellent example, we have a company that we work with a lot on payroll. It's called ECA, and their product Payroll Plus is an excellent way to take care of those kind of business problems for your practice. It's been vetted by the PDA Member Advantage Program and the PERC Board. Great discounts for all PDA members. And finally, for those of you looking for an environmental waste solution, CLIM is our endorsed partner for that. Available statewide, great service, great discounts for members. Now, with the commercials out of the way, I would like to introduce tonight's panel. Joining us and giving updates this evening, Dr. Ted Rockwell, the PDA president. I'll be doing a short update myself. Dr. Linda Himmelberger, our Governmental Relations Chair, Dr. Darlene Oleski, our ADPAC Chair, Dr. Jim Tauberg, our ADA Trustee, and Dr. Roopali Kulkarni, who represents PDA on the ADA Council on Scientific Affairs. That is tonight's panel. And since we've had a lot of introductory stuff tonight and taken a little longer than usual, we're going to jump right in and let Dr. Rockwell lead off. Dr. Rockwell.
Thank you, Ward. Good evening, everybody. It is nice to be here with you all. First of all, and most importantly, I want to thank everyone on the panel, all the members here watching and listening, the Board of Trustees, the PDA staff, and all PDA members who helped me during my year being president of the PDA. You made it possible for me to do my job, and I appreciate it greatly. I enjoyed it greatly, and it's been an honor. Within 9 days, I will no longer be president. You will have your next president, but I appreciate everything you have done. I have two topics. My first topic tonight is I will update the progress of the membership task force, which is very important. Next slide, please. This graph shows the decline of the membership over the last 20 years, and it's in a graph form. The bright orange shows you the decline, and it's a steady decline, basically. And then the next slide, please. This graph shows you in numbers the decline from the percentage, a high percentage to the lower percentage, and also the sheer numbers and the market share. So we have been steadily declining from 60% to 46% over 20 years. So this is the reason we need the membership task force, and I'm going to just update you on the progress. It's relatively new, and so we are just getting started. Last meeting of the membership task force was on March 9th, and you can go to the next slide. I'll talk about that in a minute. The membership task force primarily reviewed and discussed the ADA Health Policy Institute's revised proposal made and sent by Dr. Marco Vujicic, PhD, who is the chief economist and vice president of the ADA Health Policy Institute. The HPI report is a deep dive into PDA market share trends among various segments of the dentist population in Pennsylvania. There are three objectives of the proposal, which are as follows. One, identify select dentist workforce trends in Pennsylvania, including demographics, migration in and out of Pennsylvania, and practice trend topics. Number two, identify key trends in PDA market share among specific segments of dentists, including information on what segments of the workforce are really driving market share decline and what factors drive this decline. And number three, summarize the overall trends in the workforce and PDA market share, including early career dentists joining and staying in the PDA. The revised proposal removed the part about experiences from other states on membership. This information can be obtained by our executive director, asking the ADA membership team to send all the reports they have in the past 2 years on the pilots and anything else related to what states have tried to do to tackle membership. The original HPI report cost was approximately $57,000. The revised HPI report is approximately $37,000. Many members of the membership task force felt that we may pay for information that we already know in general terms. And given that, the cost of $37,000 may be too high. There is a general discussion around by the members on the membership task force that we should shift the focus to known pre-dental students, dental students D1 through D4, GPR residents, AEGD residents, and residents in other graduate residency programs. A vote will likely be taken at the next membership task force meeting, which is tomorrow. So that this graph here shows what happens when you go into the 30s. You get a big decline in membership. So early on, you have a boost of membership because it's free. They stay for a while and then it drops off. And so that is the thing to look at for future membership. Okay, that's membership. The next topic is the Pennsylvania Dental Meeting, which is coming up in just 9 days. The Pennsylvania Dental Meeting is at Omni Bedford Springs Resort in Bedford, Pennsylvania, just off the Pennsylvania Turnpike at exit 146. As of April 2nd, 2026, there are 120 dentists, 5 dental students, 40 guests and spouses, and 13 dental team members registered. Overall, this is an increase in over the last 4 years and a good turnout. The theme is Learn, Grow, and Lead, and this is both personally and professionally. The PDM will start out on Thursday evening, April 16th, with Meet Your PDA Leaders Reception at 7 p.m. This is sponsored and hosted by myself, Dr. James Mancini, your president-elect, and Dr. James Tauberg, your ADA trustee. Heavy hors d'oeuvres will be served along with a nice variety of drinks, and there is no fee for this Meet Your Leader, so don't miss it. Weather permitting, afterwards, you may join us at the fire pits for camaraderie and s'mores, with drinks available for purchase at the Frontier Tavern. We will kick off Friday with the Pitt Dental Alumni Breakfast from 7 a.m. to 7:45 a.m., and then the keynote speaker address, Leadership in Life and Service, presented by Major General Sean T. Collins, Air National Guard and Space Force Medical General, from 7:45 a.m. to 8:45 a.m. Please, if you go to the breakfast, that's Major General Sean T. Collins. I served under him before he was a general and have kept in touch with him since then. And as many of you know, I was in the Army National Guard and then the Air National Guard, and I retired back in 21 from the Air National Guard. Anyway, please leave the breakfast in time to get to the keynote speaker before 7:45 a.m. After the keynote address by Major General Sean Collins, the exhibit area will be open until 3:30 p.m. The CE courses on Friday are Restoring Dental Implants, a practical approach to clinical success, presented by Mark Hyman, DDS, from 9 a.m. to noon. And number 2 is Evidence-Based Analgesia, for post-surgical dental pain presented by Catherine Thieken, PharmD, PhD, from 3 p.m. to 5 p.m. There will be a luncheon address by Dr. Marko Vujicic entitled Looking Ahead to the Next Era of Oral Health from 12:15 p.m. to 2:45 p.m. For the BOT members, there is a meeting all day long from 9 a.m. to 5 p.m. Friday evening, we'll have the two main ticketed social events open to everyone. The welcome reception to mix and mingle with friends and colleagues from 6 p.m. to 7 p.m. and the member celebration and awards dinner to honor those who are making an impact on our profession and to have a great dinner from 7 p.m. to 10 p.m. Saturday starts off with the Council of Trustee Regions meeting for those on the CTR, and that is chaired by Dr. Mancini. The CE courses on the morning of Saturday are number 1, Act 31, Child Abuse Recognition and Reporting by Dr. Angela Stout from 8 a.m. to 10 a.m. and 2, Emergency Preparedness in the Dental Office by Dr. Ross P. Carlin from 10:45 a.m. to 12:15 p.m. There are 2 CE events in Saturday afternoon. The first one is a poster contest, and that was a great success last year. That's where dental students and residents do a scientific poster, and everybody who attends can vote. So go up and vote. You get one credit just for reading the posters and voting. It's real easy to do. So go to the posters and do that. And then number 2, restorations with high strength injectable composite by Dr. Robert Morris from 1:15 p.m. to 4:15 p.m. The PDA's business meeting and breakfast from 9 a.m. Next slide, please. From 9 a.m. to 11:30 a.m. will feature ADA President Dr. Richard Rosado speaking, and also legislative updates, officer and perk reports, new dentist outstanding achievement awards, leadership academy graduation, and town hall open forum and questions. We are very privileged this year to have Dr. Rosado. He'll be a great speaker. He's very energetic, very positive, and you don't always get the president of the ADA, so we're happy to have him, obviously. Dr. Mancini's first PDA BOT meeting will be from 2 p.m. to 4 p.m. And it should be noted that 2 of the candidates for ADA president next year are coming to our PDM, but they are not campaigning. They're just coming to visit. And they are Dr. Karen Arani and Dr. Randall Markarian. So we'll conclude the 2026 PDM with a ticketed reception from 4:30 p.m. to 5:30 p.m. for members of the American College of Dentists, the International College of Dentists USA Section District 3, and the Pierre Fouchard Academy. I think it'll be a great PDM. I hope everybody's coming, and if you're not signed up, sign up, please. Thank you. That concludes my report, Ward.
Thank you very much, Dr. Rockwell. A lot to cram in there, but it's busy at this time of year always. With that, we'll get into the quick update I'm going to do. This actually does cover a topic that was suggested during the questions that you were able to offer during registration. Next slide, please. Specifically, we were asked for an update of the tripartite conversion. Some of you may remember this was done. Basically, our hand was forced by the ADA software conversion, and there was an effort to try and also kind of streamline some things, as well as to make sure there was appropriate value for members at the local level in a uniform experience across the state. We started out, as many of you may remember, we had 10 districts, and under that, 46 locals. That was the format for many years. Next slide, please. But after a year plus of considerable reshuffling and trying to align everybody to make sure they met the criteria that established by the new bylaws for what is an active society, making sure that our members are getting that full benefit of their local relationships, we now have 23 truly full active societies across the state. A couple of them are technically still inactive, and the board may be taking some action there to remedy that. And we have a few that are kind of in a gray area where they're still working on some things to become active, or we're just not sure. But as of today, this is where we stand. Next slide, please. Now, those districts were transferred into trustee regions. They're not governance entities, but that's how we determine representation on the PDA board. And Some places, essentially, the locals all came together, and essentially that old district, that is the local now. You'll see that in Region 1, it was always the case, but also 7, 8, and 10. One local where there used to be a district. And everybody else is consolidated at least a little bit, but this is kind of how it breaks down region by region. Next slide, please. The one thing that's kind of holding us up a little bit, those 5 criteria that everybody had to be considered active. You got to elect officers, got to provide for your financial support, communicate to the PDA, communicate to the members, and when you're communicating them, have a meeting at least once a year. Those things are all pretty much doing what? Well, bylaws, though, which everybody's required to have. If you're incorporated, you're required by law. If you're not, the IRS definitely wants you to have them. We don't have records for very many local societies actually having bylaws. Those 4 are the only ones for whom it is confirmed by the PDA. 2 others we know are about to get it done. So anybody listening here who's on their board locally, you know you got bylaws, please send us a copy so we can check that box for your society. Next slide, please. Another significant reorganization of PDA governments has been a revamp of our committee and council structure. This is an idea that came out of our strategic forecasting committee and is just launching, beginning with the board meeting this April, where new committee members will be appointed. The structure basically is to put groups of committees under a council, and that council will have representation from each of the committees under it, such as this one, the Government Relations Council, and those 4 committees. Next slide, please. Same thing for the Membership Activities Council. All those councils tend to have committees tend to have very similar roles that occasionally could overlap a bit. By having them grouped under a council and having representation from each on a council, they will coordinate their activities better, eliminate some redundancies, and break down some silos. The asterisk you see takes note that those couple of committees with 1 asterisk, there are only 2, actually require representation from each of the trustee regions. Next slide, please. But where you see the 2 asterisks, well, that's the only committee, the Annual Awards Committee, where it's essentially all ex officio members. They're assigned by virtue of having another office. All the rest of them have to have a minimum of 5 members based only on interest and their willingness to serve, and they can have as many as they want. Last slide, please. And there are just a couple that didn't fit neatly under any council structure, so they're still independent there. Communications and PR Committee and Elections Working Group. But this new structure we're excited about because it should, again, make the work a lot more efficient and hopefully produce some great results once we get all the positions filled. And if any of you are out there are interested in serving in any of these committees other than the Annual Awards Committee, which I said is filled by people in ex officio roles, please contact the PDA. Let us know because we have room for more. Now, with that, I'd like to go on to our next update, which is coming from our Governmental Relations Chair, Dr. Linda Himmelberger.
Thank you, Ward. Before I launch into my report, I did want to just piggyback on Ted's plea to attend the PDM. I happened to read a report put out by Condé Nast of the best resorts in Pennsylvania. And Bedford Springs came in number 6 in the entire Commonwealth. Nemacolin was number 1. Hershey was number 4. But this is a great location for a meeting, and the committee has done a fabulous job of putting together a really great program. So I encourage all of you who have not yet signed up, sign up for a really great venue and a really great program. And so we can say hail and farewell to our outgoing and incoming presidents. All right, so next slide, please, Michelle. So tonight I want to give you an update on 3 of our legislative priorities. If you had the opportunity to listen to our Front Street 411 from this weekend, some of this information will be redundant, but I don't think it hurts to hear it again. So 3 of our primary legislative priorities for this year were legislation surrounding network leasing, dental loss ratio reporting, and credentialing reform. Next slide. So let's talk about network leasing first. Senator Argyle will hopefully be introducing this network leasing legislation. It has not yet been introduced, but in a nutshell, what this legislation would allow is for a dentist to opt out or opt in to a contract with the insurance company at the time that the dentist signs the initial contract. The insurance companies would also have to contact the dentist and say, we've sold this contract to others. Do you want to still stay with us? If the insurance company leases that contract, they have to contact the dentist and say, are you in or are you out? And every time the dentist renews that contract, they also have the opportunity to opt in and opt out. And they can opt out without penalty. So this would be a real win-win for us. Stay tuned. Hopefully we're going to be introducing this network leasing bill soon. Next slide. All right. The next big one is our dental loss ratio reporting. And recognize that it says reporting. This bill has been introduced. It's House Bill 1325 by Representative Kyle Mullins. And just when we're talking about a dental loss ratio, what are we talking about? In the numerator would be the numbers of dollars that are paid out to patients. The denominator is how much have been collected in premiums. There's a few little, it's not quite as straightforward as this, but this gives us our jumping off point. So this gives us the ratio, how much is paid out, how much was collected. As I said, we're only asking for the insurance companies to report what these ratios are. We are not establishing a ratio. We ask in our legislation that all plans, regardless of their size, that provide dental coverage would have to be reported under this legislation. And if the insurance companies fail to comply, there would be penalties that could be assessed if they refuse or don't report their data on time. Next slide. Shockingly, the insurance industry is pushing back a bit on this legislation, and they would like to introduce an amendment where they would only have to report ratios for standalone large group policies, those that cover more than 50 employees. And they said that they are paralleling legislation that was adopted in Virginia. So we did a little bit of investigative work here. So the first question that came to mind is, why would they only want to be reporting on those groups that are 50 lives or more? How many in all of Pennsylvania, what percentage of the plans cover a group that size? What percentage of plans are for groups that are smaller than that size? Is this tied in any way to ERISA? We aren't quite sure. We're reaching out and seeing if we can get some additional information. Interestingly, though, in the Virginia model, it is true that the legislation that was passed most recently did only apply to those standalone large group policies. But here's where it gets interesting. The reason for that is because Virginia had already passed legislation that included those groups that were less than 50. So in fact, in Virginia, insurance companies have to report these ratios for the entire breadth and depth. with that information, knowing what this Virginia model really is, we have decided that we are going to fight this amendment. We are going to go ahead with our legislation and have additional discussions with the insurance industry. But for right now, we are going ahead with our legislation as it was introduced. Stay tuned. Next slide, please. All right. Next is credentialing. This legislation has been introduced in both the House and the Senate. You can see it's House Bill 544, introduced by Representative Stephen Metzer, and Senate Bill 888, Senator Argyle. Under this, the insurers would be required to accept the CAQH application. And for those of you who are wondering, CAQH is a nonprofit organization that stands for Council for Affordable Quality Healthcare. In addition, once a dentist has submitted an application, the insurance company will be required to notify the person who's submitted the application of any errors within 10 days so that those errors can be corrected. And then once any errors have been corrected, the credentialing, who's ever requesting this credentialing, would have to process that within 45 days. And again, if the insurance company fails to meet those deadlines, there would be penalties for those deadlines not being met. So stay tuned. We're working on this one, and we're holding firm to the legislation as it's been written. Next. One of the things, I've given you an update on 3 pieces of legislation. The PDA government relations folks, as well as the Government Relations Committee, every month reviews a list of all of the legislation that's been proposed that may somehow impact our profession. And that runs to more than 50 pieces of legislation. So sometimes what happens with government relations is not what we get past. It's what we don't get past. So we are constantly reviewing what is going on in Harrisburg. And one of the things that's starting to bubble up is artificial intelligence. Just a few weeks ago, there was a joint meeting of the House Health and House Communications and the House Technology Committees. They brought together a panel. There were no dentists on the panel as far as I know. It was representatives from the insurance industry, representatives also from different health entities around the state. Very interesting back and forth discussion. Some of the pluses for artificial intelligence that were brought out at this meeting was they would be able to more rapidly detect fraud and waste. One little snippet of information here. I said dentistry was not really represented. The only time dentistry was mentioned was when one of the larger insurers in the Commonwealth noted that they had detected fraud and waste in a dental office using AI. Ounce of prevention, pound of cure. They also noted, particularly the medical folks, hope that this would simplify and reduce administrative burdens, and thereby cutting down healthcare costs. They also, on the medical side, talked about the potential for inaccuracies in records. They talked about how using even spell checking apps, if it's a word, even if it's not the right word in a sentence, it might get skipped over because spell checker knows that that's the right word. And they also used a very interesting example, I thought, where they had used AI to transcribe mental health records of a patient who was suffering from schizophrenia. And the AI transcribed it to say that the fellow was having trouble with his cat. What he actually said was he thought his cat was an alien who was spying on him. Very different kinds of problems. So the folks, particularly on the medical side, did say there has to be human oversight. There has to be guardrails. We can't just accept what AI is telling us. One of the other interesting topics that came up was the issue of liability. Who's responsible if AI gets it wrong? Is it the folks who developed that AI tool? Is it the physicians or the healthcare establishment that got it wrong? Is it the insurers that got it wrong? So stay tuned for that. That's also going to be very interesting going forward. One other thing I would tell you that we are also keeping a really keen eye on is the Family Leave Act. That's been getting a lot of press lately. And what that says essentially is it would require employers to pay for family leave in a whole different variety of scenarios. And frankly, as the Government Relations Committee was reviewing this, for employee dentists, this could have one way of looking at it. Employer dentists may be looking at this in an entirely different way. So again, we are following this closely and we will keep you updated. Next. Okay, on March 11th, there was a very informal joint meeting of the PDA, the PDHA, and the PAGD. There were a number of different topics covered, including community water fluoridation, licensure compacts. The hygiene folks did note that they were very much in favor of the ADA CSG compact. I would remind you that the Hygiene Association was at the table with the ADA when that compact was being developed. So they have pride of ownership in that compact. Hygiene Association also indicated that they have been asked by their national organization to look into the possibility of establishing an independent hygiene board. Right now in Pennsylvania, we have a hygienist representative on our board. So they have started to solicit input from hygienists. In Pennsylvania, if you have a board, that board must be self-supporting. So in other words, whatever licensure fees your profession, your group is paying must be enough to offset the cost of running the board. I have no idea how much that would mean for hygiene licensure fees going forward, but I think that's something they have to look at. And again, last but not least, we've been highlighting workforce for a long time. I think you all know that this has been trending down in Pennsylvania. We've lost 13% of our dentists. And I believe it's the last 10 years. Maybe somebody can help me with that. So some of the solutions were, do we increase the number of hygiene programs? Why are hygienists leaving? And maybe we need to encourage the dental schools to accept as many PA applicants as we can. And that leads us into our last slide. So a couple of weeks ago, Jim Mancini and I had the distinct opportunity of attending the HOSA Health Conference in the Hershey Hotel. I can't even begin to tell you, Jim and I didn't get lunch. They served us box lunches. We would eat a bite, put our sandwich down, eat another bite. There were more than 2,000 students there. I don't think we talked to 2,000, but we probably talked to hundreds. These are high school and middle school students, career and vo-tech programs as well. Jim and I talked to them about opportunities as dental assistants, EFTAs, hygienists, and dentists. We had a chance to do some, I'm reading the chat, sorry. We had a chance to do a little unscientific polling. And interestingly, those folks who were going in or seeking a career as assistants or hygienists were doing that because they had a parent who had encouraged them. And we asked them if their dentist or their hygienist or an assistant had ever said, can we, have you thought about a career as an assistant? Have you thought about a career as a hygienist? And we got a resounding no. So I think, if we're pointing our finger and saying somebody has to promote, remember there are 4 fingers pointing back saying maybe it's up to us to say to our patients, have you thought about a career as a hygienist? Have you thought about a career as an assistant? And help our own selves through our own self-promotion. And I've been told I'm running way over, so I will stop at that point.
Thank you very much, Dr. Himmelberger. Yeah, over on time, but there was a lot of really good information in there, and especially that workforce initiative there, going to the conferences, very important. Dr. Oleski, you got a report on ADA Lobby Day for us, I believe.
Absolutely. Thank you so much. As you all know, we had a little bit of a change in the way that we ran Lobby Day this year. And of course, it was brought upon by the financial situation that the ADA has been dealing with for some time now. So what we wanted to do was make it more impactful for our dentists, making it more impactful for our students, really have time to mentor our students in our lobbying efforts. And that's what we did. And it worked really well. Let me give you some quick stats before I get into what we actually were lobbying on. We had 46 states and Washington, D.C. and Puerto Rico attended. We had 524 attendees. 285 of them were dentists and 148 were dental students. And 48 state and local staff of the states were there as well. The important number there is the amount of dentists and dental students, 285 to 148. In previous years, the number of dental students has been actually increasing over the amount of dentists. And really, it's a return on investment issue as well, because we weren't seeing the students necessarily becoming ADA members after they had finished dental school. So we were trying our best to do what was right for ADA, but was to do what is right for our lobbying efforts as well. So we had 327 meetings on the Hill. And the issues that we dealt with were, first, I'll say about the student loan and postgraduate educational debt, which is, we called it the READY Act, which is the Resident Education Deferred Interest Act. It is not a loan forgiveness bill, but it is a way that if students are planning on going into residency programs, that the interest rates on the interest on their loans is deferred for that period of time. And it's important to do that because there is now a $200,000 cap beginning this summer on what students can receive in federal loans. And also, we need to make sure that our students don't have to make career decisions and choices based upon student debt or increasing their student debt by going into residency programs. We need specialists and we need academicians. We need people in rural areas that can do a wide amount of different procedures, and we need their specialty training in that. And the students that we had from Temple really did a great job at explaining that. Many of the students that we had from Pennsylvania really talked about wanting to go to rural areas, and it was really impressed upon them, especially because they don't feel that they're getting all of the experience that maybe some of us have gotten in dental schools. They wanted to further their education, whether it was a specialty program or in a residency, to kind of get more procedures under their feet so that they can treat those patients in the rural areas better, because they know many of those patients don't want to travel to larger cities to seek specialty care. So that was our READY Act. Next slide, please. ERISA, which is our act that we were talking about. Basically, these ERISA plans are using a loophole to prevent from having to follow the rules within our state. So we have prompt payment, we have non-covered services, and we have virtual credit cards. Well, these insurance companies that are under this ERISA umbrella can say that even though we have these laws in Pennsylvania, they don't have to follow them. So this act, if it became law, would be closing that loophole so that those ERISA plans would also have to follow the same rules. And we're very lucky in this because we have Van Drew, who's a dentist, and Herb Ray. It's a bipartisan bill that we always try to push bipartisan bills when we go to Washington. And Herb Ray, which is a physician. So we're kind of covering a lot of the medical spectrum on there. So we did have some nice success with that bill so far. And we are getting co-sponsors. Right now, I just wanted to note that we have 9 House members signed on to the Variety Act as co-sponsors as a result of Lobby Day. Next slide, please. And this was a little bit more difficult to explain, but you know that many of the programs within our federal government have been cut, specifically our healthcare, like the CDC programs, NIH programs, HRSA, and we have lost key people in those positions. We have lost the dentist chief advisor, and that doesn't work very well for us because there's still monies being funded into some of these programs, and those programs are being run by bureaucrats who have no idea what is truly important to our population. So we're asking so that these positions are filled and filled appropriately with the appropriate staff so that funding can happen, the appropriate research can happen. And you have to remember with HRSA, we're looking at also our students who are doing their service work in states that are providing them loan repayment and what's happening with these programs. So this is just to get the right people in the right job, make sure they're thinking about it and knowing that they have to make some appointments. The other thing I wanted to talk about is we just had a leadership meeting Monday with CGA and ADPAC. CGA is ADA's version of the Government Relations Committee. And we're trying to kind of formulate a better lobbying program for ADA and having it trickle down to grassroots, to our state levels, to our local levels. For me, this was my focus as ADPAC chair. I really think grassroots is where we're going to hit the most legislators, where I think we're going to do the best work. So we're working to do, as a result of the students not being able to go to Lobby Day, as many students as going to Lobby Day, we are working on a program called Local Lobby Day. And we in Pennsylvania did that a few years ago at Temple and was extremely effective. So the dental students at the schools would invite legislators in, they'd walk them around, talk to them about debt repayment, what they plan to do, and ADA has a toolkit for that. The other thing that we're working on is Tour Your Office, Legislative Tour Your Office Day. So right now, in fact, I just reviewed that policy about an hour ago, where ADA creates a toolkit where you can invite your lobbyist to lunch or invite your lobbyist to your office for lunch and talk to you and your staff about problems that you're seeing in your own personal office. We all know that a personal story is better than a form document anywhere. So that's what we're working on. The other thing that we're working on is soft dollar contributions in terms of corporate donations to our lobbying efforts, something we're calling Friends of Dentistry. And when we look at that, we're really looking at like people, companies like Care Credit. Care Credit actually did fund some of the activities at Lobby Day, but we're looking at Care Credit, maybe some of our larger dental companies like Henry Schein or Patterson that would become contributory to the soft dollars. Hey, if we succeed, they will succeed even more. So we think it's a easy ask. I'm not sure how much we're going to get, but at least we are going to ask for those kind of contributions. We're always told we are a small player in Washington, even though we have a very big voice and we have a big footprint. If we can get our PAC donations to probably double what they are, we know that we can't keep asking you individual dentists for them. That's not fair. We can't keep draining this well dry. So we're going to need to go outside the box a little bit and look at maybe corporations that would be interested in healthcare and oral healthcare initiatives. And if we can get it to about double where we are, we then become a major player with not just a big footprint in Washington, D.C. So that's what we're working on. And I think that's about all I need to talk to you guys about, and I'll keep you guys as close to on time as you can be. Thank you all so much.
Thank you very much, Dr. Oleski. There's a lot to cover. We still got more coming from the ADA from our trustee, Dr. Jim Tauberg, who's masquerading as Dr. Himmelberger tonight, but we know who you are, Jim. Go ahead.
Well, thank you. I certainly will defer to my colleague, Dr. Himmelberger, as being, as we talked earlier today, the much better looking one of the two of us. Anyways, to move right along, can I have the first slide, please? So one of the biggest news is in the ADA, in fact, the biggest news at the ADA, is that we have a brand new executive director, Dr. Nadir A. Nadershahi. He is a dentist, he's a master's in business administration, and a doctor of education. And he is our new ADA executive director. He was selected due to his exceptional business acumen, his empathy to listen to our various stakeholder groups. He builds consensus and translates that dialogue into a very effective operational plan, reflective of the ADA's mission, vision, core, and their strategic forecast. Prior to this, he spent 9 years as Dean of the University of the Pacific, and he is now going to be that person who will be responsible for shaping and delivering a strong value proposition to the ADA members and maintaining that focus on the needs and the interests of those members. Just real quickly, basically this went through a global leadership advisory firm named Russell and Reynolds and Associates, who conducted the search. There was an oversight provided by an executive director search committee. There was over 200 applicants. That was pared down to 15 to 7, 7 to 3, and then the final candidates. And ultimately, Dr. Nadershahi became that new executive director. I will do a quick thank you to our previous interim executive director, Dr. Elizabeth Shapiro, who spent countless hours serving as that interim director over the past year. And the two of them did work together, but as of the 23rd of March, it is now fully in Dr. Nadershahi's corner. So together, I hope we'll build an exciting future for the profession in the ADA. Next slide, please. So at the lobby day, we had an entire morning where the American Student Dental Association district representatives and the American Dental Association Board of Trustees had a joint meeting. We talked about a number of issues that affect dental students. The first was really, and most important, was student loans, and I'll bring this up again in just a moment. But they were wondering, gee, how can the ADA Credit Union, the BCU or Baxter Credit Union, which I'll explain in a moment, are one and the same, could they help out with student loans? And actually, we actually have contractual relationships with other companies right now, and that is through the American Dental Association buyers and insurance legal contracts, and that is for Laurel Road and Key Bank. Panacea does work for practice finances, and until those contracts actually end, we really cannot use the credit union at the current time for anything with student loans. But you might say, well, then, can the credit union be of any help to ASDA? And the answer is quite a bit. So basically, what they can use it for, and I'm going to just read this really quickly, is they can use it for fees applying to residency, for licensure moving, for moving expenses, for auto loans, for applications to residencies. In fact, it's a great way for them to apply to a loan and actually get credit, because many of them, being in school, do not have any way to have credit. So it's a great way to do that. By the way, one of the things that's great with the credit union is once you join, and it costs $1 to join, $1. Once you join the credit union, everybody in your family is then able to join that union. We're talking eligible spouses, parents, children, siblings, domestic partners, grandchildren, grandparents, aunts, uncles, nieces, nephews. It's everybody. So it's really a great thing to do. And actually, the credit union and Baxter Credit Union, the ADA Credit Union, that is, are really one and the same. It's a great thing to do. It is really owned by us, by the credit union. It's not owned by anybody else. It's nonprofit, and all the profits that are made from it are sunk right back in to make sure that you get the very best rates and the best deals possible. So that's what the Baxter Credit Union is all about. Let's talk real quickly about what we talked about with ASDA. I think there might be one more slide, please. And one of the things that were talked about is how could we help the students? So one of the things they talked about was creation of practical anatomy exams or INDBE practice exams. And after a lot of discussion, it was determined that students can already get OLE exams. We all did that when we were probably students for anatomy and for dental exams. But what there's something out there called boot camp practice exams. And it turns out that what they'd rather see is have a conversation regarding ADA or state-sponsored boot practice exams. Actually, as the members right now get 10% off, but some schools have already made their own negotiations. For example, the University of Pittsburgh gets their students 25% off on these boot camp practice exams. So something to talk about for the future. Another thing they talked about, and again, bringing back school tuition and federal subsidized loans, they really are very concerned about the tuition costs. They really believe that somewhere along the line we have to have controls. One of the students made the comment is, don't we all teach skills in every dental school of how to pass your ADEX and how to pass your Dulosky? So if that's the case, why are the tuition so wild everywhere? They're worried. They're really worried that the cost to schools may increase so much that it's going to affect the workforce. You might say, how? Well, number one, if the student loans are capped and the costs are increased, then any additional loan may not be affordable and may affect, one, how you get into dentistry in the first place, and two, many of our specialty residency training programs you have to pay for. Well, then there's a problem. Can they afford to go into specialty practice? So we're going to talk about if the problems go unaddressed, there'll be an issue with, do people want to go into our field of dentistry? And if they are in our field of dentistry, do they want to go into specialty training? So some really good ideas that were brought up by the students. Another thing they talked about is, where do students look for their information? No, they do not look for it on Facebook. That is for people of my more mature age. Not that you can't do things on Facebook, but they really talk on TikTok and Instagram, and they would really like to have something in the future, maybe that we could do through the ADA, to have a kind of collaborative button that you push so that somehow we can all work together with it. They did talk about pre-dental clubs. One of the ideas was, could you actually do something to help the college students choose dentistry? And they want these kind of pre-dental clubs to occur at many different universities and colleges. Again, it was just a thought. We didn't get into any specifics. Last but not least was the mentor program, and they really wanted you to think outside the box. So just two thoughts. One, they talked about that this really needs to start certainly while you're in school. So they talked about tailored programs for those students who want to go into general practice versus those students who want to go into specialty practice versus those students who wanted to go into either large group practice or DSOs. So they wanted to have something that would help those students understand that in a mentor program. The other thing I thought was a lot of fun and way outside when you color outside the box was a party bus. A party bus, kind of like a progressive learning. You know, you get in a party bus and you go progressive dinners, you go somewhere for appetizers, some of your main course, somewhere for dessert. Well, could they do something where they go maybe to 3 offices and stop into the offices and meet with the staff and the doctors? So something where you'd hop on the bus and you stop at 3 different offices and get an idea. And they could be, again, GP offices, specialty offices, DSO offices. So they had some really great ideas. So a lot of interesting ideas came out of this joint meeting. I'm going to mention 2 other things because my time is more than up. I'm not going to mention too much on finances, except that we are certainly working very hard at the ADA level through the finance committee, through the treasurer, through the new executive director, to make sure that our finances are kept under very, very good control. I will tell you that the budget is a positive step forward. We know that 22-24 was a heavy financial investment period, and we're continuing to work together to reprioritize, our resources and build some sustainability for the ADA's future. Two other quickies. One, we now have a new person who's in charge as Chief Business Product Officer. That is a Miss Deborah Doherty. She will be in charge of the sales strategy and product development, publishing, sponsorships, corporate relations, database licensing, the SEAL program, Attabuy, and insurance portfolios. So we look forward to working with Ms. Doherty in the future. Last but not least, two other quickies, and this will help for the final introduction to our person on the Council of Scientific Affairs. But number one is Mr. Ward Blackwell was nominated to stay as the American Dental Political Action Committee Board of Directors State Constituent Dental Executive through 2027. So congratulations, Ward. And most impressively, Dr. Roopali Kulkarni, who is the new dentist representative, correct me if I'm wrong, Roopali, on the Council of Scientific Affairs, has been voted to be now an official member of the Council of Scientific Affairs for the next 4 years, starting this coming House of Delegates. So, Dr. Kulkarni, congratulations on a 4-year position as a person from Pennsylvania and representing us proudly. Thank you so much. That's for my report.
Thank you very much, Dr. Tauberg, and that's a perfect segue into Dr. Kulkarni's report on the council's activities.
Thank you so much, Ward and Dr. Tauberg, for that. I'm looking forward to representing Pennsylvania for 4 more years on the council, and I will provide just a brief verbal update as a member of CSA. So CSA has been involved in a number of long-standing and also new initiatives, and I wanted to highlight 3 in particular, 3 that are relevant, of course, to us as clinicians, but 2 primarily because of the pride that we have in the work that we're doing in Pennsylvania. So the first is there was a call to action last year as part of the ADA SEAL program to have dental schools partner with the SEAL program to be considered as a qualified testing site for possible products. And recently, both the University of Pennsylvania and Temple University were approved as qualified testing sites. So that brings a lot of pride, of course, to the dental schools and the work that they can do to support the initiatives of the ADA. The second is the council is undergoing review and report of the clinical guidelines from the Orthopedic Surgery Association regarding the movement towards antibiotic stewardship. And so there will be a report actually from the council that is published in JADA and is in response to the evidence that we have, as we're always in evidence-based practice, looking towards the methods that we have for antibiotic prophylaxis, especially as we know there's conflicting evidence in this state that the Orthopedic Surgery Association was citing. So that will be published in JADA for review shortly. And then the last, which is a major exciting development, and you may have heard a bit about it, is the ADA Living Guidelines Program, which is a guideline program that was created in conjunction with one of our own schools, the University of Pennsylvania. And the goal is to create living documents that allow for evidence-based changes to be implemented in clinical practice guidelines so that we as dentists are being informed in the most up-to-date way to practice. So you may be aware that April is Oral Cancer Awareness Month, and so the oral cancer guidelines as it relates to diagnosis and management, in addition to potentially using adjuncts in diagnosis, those recommendations were actually compiled, and all of that information is on the ADA website. So I would encourage you all to go to the ADA Living Guideline Program website. They're beautiful infographics that summarize all the work that's been done. It's a really easy, easy way to digest the information, and then you can directly apply it to your clinical practice. And what's unique about this living program is it really gets updated as evidence updates. So it's an exciting initiative that one of our schools is also a part of, and we as the council help oversee and guide some of the initiatives that the program will undertake. So those are my 3 major verbal updates, and I really appreciate the opportunity to represent and to report back to you all. So thank you.
Perfect. Well, and we really appreciate your service and your ability to pack a lot into a short time, Dr. Kulkarni. So we've come to the Q&A portion. We are actually at the bottom of the hour, and normally we wrap up right at 60 minutes. There's no way we're getting to all the questions we've gotten tonight, but I am going to take the liberty of going a couple minutes over to at least get one in, because it happens to be just a little bit timely, because I understand of some of the things going on. So this is actually directed to Dr. Kulkarni. Came from one of our members here. With increasing scrutiny on microplastic exposure in healthcare materials, including dental composites, is the PDA actively reviewing the long-term biological and environmental impact of resin-based restorations? And are there any initiatives underway to assess or regulate particulate release during placement, wear, or removal? And I believe you said CSA is actually starting to look at microplastics.
That is correct. So this is extremely timely. CSA was very proactive in compiling not only the information that we have currently, but also putting together a group of experts to better understand the effect of microplastics on our patients, overall health, the environment. So there's actually going to be a lot more to come, fortunately, on that. And I think the goal is really to help inform, clinical practice, or how that might change how we approach, treating our patients. So that's actually in the works now. And hopefully I'll have more information for you throughout the year as that group works on this information for us.
Really appreciate that, and very timely. Thank you so much for the response. Folks, we're obviously over on time. Those questions we got that we couldn't get to, we will try and get written responses out and share that with all the attendees. So, appreciate your participation, and just know that we can't get to everything live, but we will address them all. With that, quick reminder that for those who don't see these live, any of your colleagues, and you think it's worthwhile to share with them, they are recorded and can be found on the PDA's webinar and video library on the website. It's in the members only content area. So every member is welcome there, and hopefully we get some other people interested in joining, just be able to see the content. And with that, I'll also remind you, we do these every other month. The next one is going to land on June 1st, because we alternate Mondays and Tuesdays. So we hope everybody will join us then. And until then, have a great evening. Thanks for bearing with us as we went a couple minutes long, and we'll see you in summer.
Thank you, everybody.